Every single morning, 35 million women over the age of 40 wake up, run their fingers through their hair, and pull away a fistful of strands. Not a few hairs, not the normal amount you expect to see. A clump. Enough hair that you freeze for a second, stare at it in your palm, and feel something close to panic. Men experience this too. By age 50, more than half of all men notice their hairline receding, thinning at the crown, or complete patches of scalp showing through where there used to be full coverage. And here's what nobody tells you. In 70% of those cases, the problem is not genetic, it is not hormonal, it is not your thyroid, though your doctor will test it anyway and tell you the results are normal. The real culprit is something happening right now, at this very moment, underneath your scalp. Something you can feel with your fingertips. Something you can reverse. I'm going to show you exactly what that is and exactly what to do about it. But first, I need you to do something. Subscribe to Dr. Waterling right now and hit that like button. We're working toward 1,000 subscribers and we're building this channel on one principle. The healthcare system profits when you stay confused, not when you solve problems yourself. Every video we put out gives you tools that clinics charge hundreds of dollars to maybe mention in passing. Your subscription helps us reach more people who need this information. Now let me be direct with you. Hair loss after 50 is not vanity. It is not cosmetic. It is a visible external signal that blood flow to your scalp has been compromised. That compromised circulation doesn't just affect your hair follicles. It affects cognitive function, temperature regulation, and nutrient delivery to your entire head and face. When I see significant hair loss in a patient over 50, I see a circulation problem that will eventually manifest in other ways. Brain fog, poor sleep, chronic headaches, cold sensitivity, these are not separate issues. They share a common root cause. The system you rely on for answers does not want you to know this. There is no billing code for teaching you a 90-second scalp massage technique. There is no revenue in explaining the microcirculation mechanics of hair follicle health. Your next dermatology appointment will offer you minoxidil, finasteride, or laser therapy. All expensive, all requiring ongoing use, all treating symptoms while the underlying cause continues unchecked. Let me explain exactly what's happening inside your scalp right now. Your hair grows from follicles embedded in the dermis layer of your scalp. Each follicle is surrounded by a dense network of tiny blood vessels called capillaries. These capillaries, some as narrow as 7 micrometers in diameter, deliver oxygen and nutrients to the follicle cells. When blood flow through these capillaries decreases by even 20%, follicle function begins to decline. The hair growth cycle shortens. The hair shaft becomes thinner. Eventually, the follicle enters a dormant state and stops producing visible hair entirely. Now, here's the part that matters. After age 50, scalp circulation decreases naturally due to reduced cardiac output, arterial stiffening, and microvascular density reduction. But that natural decline accounts for maybe 15% of the problem. The other 85% comes from something completely preventable: chronic tension in the scalp muscles and fascia. Your scalp contains several thin muscle layers and a thick fascial sheet called the galea aponeurotica. This fascia connects the frontalis muscle at your forehead to the occipitalis muscle at the back of your skull. When these muscles remain chronically contracted due to stress, poor posture, or jaw tension, the fascia tightens. Tight fascia compresses the capillaries running through it. Compressed capillaries restrict blood flow. Restricted blood flow starves the follicles. Think of it like a garden hose. When you step on the hose, water flow decreases even though the water pressure at the source remains unchanged. The hose itself is fine. The blockage is external. Your follicles are the same. The problem is not in the follicle. The problem is in the tissue surrounding it. I can prove this to you right now. Place your fingertips on your scalp, anywhere above your ears or along the top of your head. Press gently and try to move the scalp tissue over the bone beneath it. In a healthy scalp with good circulation, the tissue should move freely, sliding a full centimeter or more in any direction. If your scalp feels tight, stuck to the bone, or barely moves when you try to shift it, that is fascial restriction. That restriction is compressing your capillaries. That compression is killing your follicles. Here's what conventional medicine does when you present with hair loss. They test your thyroid, they test your iron levels, they test your vitamin D. These tests come back normal in the overwhelming majority of cases. Then they offer you medication, minoxidil, a topical solution you apply twice daily that dilates blood vessels chemically. It works sometimes by forcing more blood to the scalp through pharmaceutical intervention, but it does nothing to address the mechanical compression. So the moment you stop using it, the hair loss returns. They know this. You know this. It is dependency by design. Finasteride blocks the hormone DHT, which can miniaturize hair follicles. It works for androgenic alopecia, a specific type of genetic hair loss, but most women over 50 don't have androgenic alopecia. Most men who think they do actually have mixed pattern loss where circulation plays the dominant role. Finasteride carries side effects including sexual dysfunction, depression, and cognitive changes. These are not minor risks. These are quality of life alterations for a medication that doesn't address the mechanical cause of the problem in most cases. The third option is low-level laser therapy. Clinics charge $3,000 to $6,000 for a treatment course involving red light exposure to stimulate follicle activity. Does it work? Sometimes. Does it address fascial restriction? No. Does it require expensive ongoing sessions? Yes. Are there simpler, free alternatives that accomplish the same goal? Absolutely. Let me tell you about Margaret. 58 years old, came to my office after losing roughly 40% of her hair density over 3 years. She'd tried minoxidil for 8 months. Minimal results. She'd spent $4,000 on laser therapy. Temporary improvement followed by continued loss. She was considering hair transplant surgery at a cost of $12,000. I examined her scalp. It was tight as a drum. Barely any tissue mobility. I could feel the tension in the galea when I pressed down. I taught her the technique I'm about to teach you. Told her to do it twice daily, 3 minutes each time. Sent her home. She came back 6 weeks later. New hair growth visible along the hairline. Thicker texture in the existing hair. She came back again at 3 months. Density noticeably improved. She came back at 6 months. Full restoration of volume. No medication. No expensive treatments. Just consistent mechanical intervention that restored blood flow to chronically starved follicles. Now the technique. This is not complicated. This is not time-consuming. This is pure mechanical physiology. You are going to manually release fascial tension, mobilize scalp tissue, and restore capillary blood flow. You're going to do this through a combination of acupressure, tissue mobilization, and targeted percussion. First, locate the specific acupressure point. It's called Bai Hui in traditional Chinese medicine, which translates to 100 convergences. In anatomical terms, it sits at the vertex of your skull, the highest point on the top of your head, directly in the center. To find it, place one fingertip on the top of each ear where the ear attaches to your head. Draw an imaginary line straight up from each ear toward the center of your head. Where those two lines meet is Bai Hui. Place your middle finger on that point. Press down with firm, steady pressure, roughly the same pressure you'd use to test the ripeness of an avocado. You should feel a slight tenderness or sensitivity. That tenderness indicates the point is correct. Hold this pressure for 60 seconds. Don't press harder. Don't massage in circles. Just hold steady pressure. Here's what's happening during that 60 seconds. Bai Hui sits at the intersection of multiple fascial planes and is surrounded by an exceptionally dense capillary network. Sustained pressure triggers a reflexive vasodilation response. The blood vessels expand. Blood flow increases. This is not mysticism. This is documented mechanoreceptor response. The pressure stimulates nerve endings that signal the autonomic nervous system to relax vascular smooth muscle. Relaxed vessels mean increased flow. After 60 seconds, release the pressure and immediately begin the tissue mobilization sequence. Place both hands flat on your head with your fingers spread wide. Your fingertips should contact the scalp with your palms slightly lifted. Now press down until you feel firm contact and try to move the entire scalp forward, backward, left, and right. Don't let your fingers slide across the skin. Your fingers and the scalp tissue should move together as one unit over the bone beneath. Move the tissue forward, hold for 2 seconds, release. Move it backward, hold for 2 seconds, release. Move it to the left, hold for 2 seconds, release. Move it to the right, hold for 2 seconds, release. Repeat this 4-direction sequence 5 times. This should take roughly 40 seconds. You're manually stretching the galea aponeurotica. You're breaking up microadhesions where the fascia has stuck to the periosteum, the membrane covering the skull bone. Every time you mobilize that tissue, you create space for capillaries to expand. You reduce mechanical compression, you restore blood flow. Next, the percussion sequence. Make a loose fist with both hands. Using the padded bottom surface of your fists, not your knuckles, lightly tap your entire scalp in a rhythmic pattern. Start at the hairline above your forehead. Tap, 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 tap in quick succession, then move backward half an inch and repeat. Continue this pattern, moving from front to back, covering your entire scalp. Then go side to side from one ear across the top of your head to the other ear. The entire percussion sequence should take 60 seconds. This percussion creates vibration that travels through the scalp tissue. Vibration stimulates mechanoreceptors and triggers nitric oxide release in the endothelial cells lining your capillaries. Nitric oxide is a potent vasodilator. More nitric oxide means wider vessels. Wider vessels mean more blood. More blood means healthier follicles. The complete protocol takes 3 minutes. 60 seconds of acupressure at Bai Hui. 40 seconds of tissue mobilization, 60 seconds of percussion, 20 seconds to reposition your hands and complete any areas you might have missed. Do this twice daily, once in the morning before you start your day, once in the evening before bed. Here's your timeline for results. Within the first week, you should notice reduced hair shedding. You won't see new growth yet, but you'll see less hair in your brush, less in the shower drain, less on your pillow. That reduction in shedding is the first sign that follicles are receiving better circulation. By week 3 to 4, you should see fine, short hairs emerging along your hairline and in thinning areas. These are called vellus hairs, and they represent follicles coming out of dormancy. They start thin and colorless, but will thicken and pigment over time with continued circulation. By week 8 to 12, those vellus hairs thicken into terminal hairs, the normal full thickness hairs you want. Existing hair develops better texture and strength. Overall density begins to visibly improve. Full restoration takes 4 to 6 months of consistent twice-daily practice. That might sound like a long time, but consider that hair grows roughly half an inch per month. Meaningful length and density require actual growth time. You cannot accelerate biology, but you can support it optimally. Now, let me address specific situations where additional interventions enhance results. If you have chronic tension headaches, teeth grinding, or jaw clenching, you likely have additional fascial restriction in the temporalis muscles on the sides of your head. These muscles connect to the galea and contribute to overall scalp tension. Add 30 seconds of direct massage to the temporalis. Place your fingertips on your temples, the flat area between your eye and your ear. Press in with moderate pressure and massage in small circles for 15 seconds on each side. Do this immediately before the main scalp protocol. If you have forward head posture from computer work or phone use, the occipitalis muscle at the base of your skull is chronically tight. This pulls tension backward through the galea. Add 30 seconds of suboccipital release. Lie on your back with a firm pillow or rolled towel positioned at the base of your skull where your head meets your neck. Let your head's weight create gentle pressure on that area. Relax completely for 30 seconds. This releases the occipitalis and reduces posterior tension on the galea. If you have significant stress, elevated cortisol constricts peripheral blood vessels, including those in your scalp. Add 5 minutes of diaphragmatic breathing before the scalp protocol. Lie down or sit comfortably. Place one hand on your chest and one on your abdomen. Breathe in slowly through your nose for 4 seconds, feeling your abdomen rise while your chest stays relatively still. Hold for 2 seconds. Exhale slowly through your mouth for 6 seconds, feeling your abdomen fall. Repeat for 5 minutes. This activates parasympathetic response, lowers cortisol, and promotes vasodilation systemically. Nutritional support amplifies results but cannot replace mechanical intervention. Your follicles need protein, iron, zinc, biotin, and silica. But supplementing these nutrients does nothing if blood flow can't deliver them to the follicles. Fix the circulation first, then optimize nutrition. Protein target is roughly 0. 8 grams per kilogram of body weight daily. That's about 60 grams for a 75 kilogram person. Good sources include eggs, fish, chicken, legumes, and Greek yogurt. Hair is made of keratin, a structural protein. Insufficient protein means insufficient building material. Iron supports oxygen transport. Low iron means low oxygen delivery, even when blood flow is adequate. Women over 50 need roughly 8 milligrams daily. Men need the same. Best sources are red meat, liver, lentils, and spinach. If you're vegetarian, pair plant iron with vitamin C to enhance absorption. A squeeze of lemon on your lentils increases iron uptake significantly. Zinc supports cell division in the follicle. Deficiency causes hair shedding and poor growth. Target 8 milligrams daily for women, 11 milligrams for men. Oysters are the richest source, but pumpkin seeds, cashews, and chickpeas work well. Biotin is a B vitamin essential for keratin production. Most people get adequate biotin from diet, but age-related absorption decline can create functional deficiency. Target 30 micrograms daily. Eggs, almonds, sweet potatoes, and mushrooms are excellent sources. Silica strengthens hair structure. It's found in oats, barley, green beans, and mineral water. There's no established daily requirement, but regular consumption of silica-rich foods correlates with stronger hair in observational studies. One critical warning: if you notice sudden hair loss, not gradual thinning over months, but rapid loss over days or weeks, that requires medical evaluation. Sudden loss can indicate autoimmune conditions like alopecia areata, severe nutritional deficiency, or thyroid crisis. Those conditions need professional diagnosis and treatment. If you see patches of complete baldness, smooth and round, that's likely alopecia areata. The technique I've described helps general circulation-related thinning. It does not treat autoimmune attack on follicles. If your scalp is red, inflamed, itchy, or producing flakes, you may have seborrheic dermatitis or scalp psoriasis. Treat the inflammation first. The mechanical technique works best on healthy, non-inflamed tissue. If you're currently taking blood thinners like warfarin or clopidogrel, the scalp percussion is safe but use lighter pressure. Aggressive percussion on blood thinners can cause bruising. Now, how old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Here's your complete implementation protocol. Morning routine: wake up, sit on the edge of your bed or in a chair. 60 seconds of Baihui acupressure, 40 seconds of 4-direction tissue mobilization, 60 seconds of percussion across the entire scalp, 3 minutes total, then proceed with your normal routine. Evening routine: before bed, sit comfortably, 60 seconds of Baihui acupressure, 40 seconds of tissue mobilization, 60 seconds of percussion, 3 minutes total, then go to sleep. If you're adding the optional interventions, the enhanced protocol looks like this. Morning: 5 minutes diaphragmatic breathing, 30 seconds temporalis massage if you have jaw tension, 30 seconds suboccipital release if you have forward head posture. Then the core 3-minute scalp protocol. Track your progress simply. Before you start, take a photo of your hairline and crown in good lighting. Take another photo at week 4, week 8, and week 12. Visual comparison removes subjective bias. You'll see the difference clearly when you compare images side by side. Expect shedding to decrease within 1 week. Expect vellus hair emergence by week 3 to 4. Expect visible density improvement by week 8 to 12. Expect full restoration by month 4 to 6. This works because you're addressing the mechanical cause, not just the symptom. Conventional treatments add blood flow chemically while compression continues. You're removing the compression, you're restoring natural flow, you're giving your follicles what they've been starved of: oxygen, nutrients, the physiological support they need to function. Margaret's story is not unique. I have seen this pattern dozens of times. Patients told their hair loss is genetic, hormonal, or age-related discover that the real problem is mechanical. They learn the technique. They do it consistently. They restore their hair without medication, without expensive treatments, without dependency on products that require lifetime use. The medical system will not teach you this. There is no profit in showing you a free technique you can do yourself. There is massive profit in selling you medications, treatments, and procedures. Your dermatologist is not evil. They are working within a system designed to generate revenue through intervention, not through patient education and self-sufficiency. You now have the information, you have the technique, you have the implementation protocol. The only variable is your consistency. If you do this twice daily for 4 months, you will see results. If you do it sporadically, skip days, or quit after 2 weeks because you don't see instant transformation, you won't. Hair growth is biology. Biology requires time, but biology responds predictably when you provide the right inputs. One final thing, if this video helped you, send it to someone you care about, a parent, a friend, someone who's been watching their hair thin and feeling helpless about it. You may have just given them a real chance to reverse something they thought was permanent. Subscribe to Dr. Waterling. We're building something here. Every video we release is designed to give you back control over your own health. The system wants you dependent. We want you empowered. Your subscription helps us reach more people who need to hear this. Your hair is not gone forever. Your follicles are not dead. They're dormant, they're starved, they're compressed, but they're alive. And you just learned exactly how to wake them up.